Well, as medicinal marijuana begins to make its way into the natural state, so do the questions surrounding it. As KNWA's Chelsea Helms found out in this special report, researchers are already looking into the medication. But will their studies get to the root of the data needed?
Before it's in the hands of patients, medicinal marijuana is on the minds of researchers.
It's a challenge.
But at the University of Arkansas for Medical Sciences in Little Rock, it's not the plant under the microscope, but the people who plan to use it.
What we're going to do is compare those persons that get the card with some of those that do not get a card but have similar conditions.
In February, Dr. Bradley Martin and Dr. Naleen Piakashat of UAMS launched an online survey for Arkansans who have or plan to get a medicinal cannabis card.
Ask people what they think about it, how they use it, what they use for, and what they perceive in terms of clinical outcome, if that help with pain, sleep, anxiety.
The ongoing project already has 1,800 participants, a number researchers expect to grow. Ultimately, they hope to learn if medical pot actually works for patients, and if so, in which form, from smoking to edibles to topical oils.
When the legal medical cannabis products are available in the market, hopefully later, probably next month or this summer, and see what change in terms of health outcome and also attitudes.
Dr. William S. Pichel of Healing Arts Medical Center in Fayetteville is already authorizing medicinal cannabis for patients who are eligible.
Takes a real big breath for me, babe.
He hopes research in the natural state doesn't remain digital.
I like to see what type of physiological basis that these particular drug indications are based on.
The doctor's referring to the 18 conditions that allow Arkansas doctors to authorize medical pot for patients. He wants studies to be conducted on patients themselves to know more about how it impacts their specific ailments.
Look at the value of clinical studies when you go to produce any kind of legal pharmaceutical.
We make better decisions when we get good information and do good research.
Republican State Senator Jim Hendren says he was skeptical from the start, but now supports research to learn more about medical marijuana.
I have been impressed by some of the evidence I've heard from people with experience in it.
He even says the state should cover the costs.
Well, we did implement several taxes and fees on marijuana, and the idea being that it should support itself.
Even those who plan to sell it say patients deserve to know more about what they're using as treatment.
This is a product that's going to be distributed and sold to the public. I think the state has responsibilities to make sure research is always happening.
In terms of actually handling the medical cannabis, we're not aware of anybody at UMS that's working with products.
And Dr. Pichel says before they can test the patients themselves, the feds need to step in with both funding and a fundamental shift.
We need to look at getting people together to change the legal structure.
Even with the limitations, for now, research at UAMS will remain web-based. After more than 2 years, dispensaries in Arkansas will have medicinal cannabis available for patients as early as next month. But in Oklahoma, medical pot was in the hands of patients within 6 months of the law passing. To see our web exclusive on how Oklahoma was able to move forward with the plant so much faster than the natural state, head to our website, nwahomepage.com. In studio, Chelsea Helms, KNWA Northwest Arkansas News.